In today's podcast, we're going to be talking about how we diagnose pain. So I'm going to use Kelly here as an example to give you a visual about what we're going to be talking during the podcast. So always the first thing I want to know is, where do you feel the pain? So Kelly, go ahead and give us a little bit example of where you're having pain at right now.
Left shoulder.
Okay. Okay. So now she's honed it into a joint. So we know it's in the shoulder. So now I need specifics. Where in the joint, or where would you say your pain is? Front, back, side. Where would you point it at?
A lot of times it's like really like in the adult area, the top of my shoulder.
The very top of your shoulder is where you're in. Okay.
Yeah.
Okay. And is there anything that you do at home or throughout your day that would cause that pain?
Really, whenever I work out, if I reach back too far, I have to like move my whole body.
Yes. Okay. So reaching back and out that way is weird. So now I'm going to do a little bit of a range of motion test to see if there's anything that's limiting that we really see blatantly as there's issues going on. So I'm going to grab your arm here. So just kind of want to make sure our whole arm is shoulder blades staying down. And all right, even that right there. She's not getting great range of motion coming up. So it's telling me we have some tightness in her adduction moving up to abduction. All right, just move forward and backwards. That one's not moving too bad. Okay. Okay, we're getting some restrictions. She's not coming back there. And let's look at some moving upward or backwards. Okay, and she's definitely not moving range of motion in there. So the three movements that we're restricting, which are, see, now we moved in, so this is a good example, as we move into that range of motion and she's getting pain. So that's the thing. So our goal is we need to get those range of motions happening. So she was definitely having trouble in all three of those range of motions. So now my first thought is starting to look at muscles that are correlated to all three of those movements. So one right off the top of my head that's in all three of those is the pec major. The anterior deltoid is in those, so those are areas that I want to know for sure is there issue. So the next step is we need to see if is there muscle tenderness or density in any of those muscles. So that's what we're going to do next, is we're going to go look at muscle density and start palpating those. Up that muscle. Now we're going to focus on elongating it and stretching it. So let's go ahead. I'm going to go ahead and get Kelly. We're going to work on that pec major. So she's having trouble getting into the position. So I'm not going to quite go into that position yet. We're going to stretch the pec major by just moving straight through this movement here. Okay. How's that feeling there, Kelly, so far?
Not too bad.
Not bad. Okay. A little bit more here. We got a little bit more rotation. Right there. That's stretching right there. Good. So right there, we're going to go in and out of that, getting a good deep stretch. All right, so now we're going to be focusing on activating the opposing muscles. Her internal rotation was really tight, so we're trying to get her external rotation stronger. So that's why we're focusing on an exercise that's going to be strengthening her external rotation.
Hey everybody, welcome back to the Body Breakdown. And of course, as usual,
hello,
Tyler, David, back in action for the, I think, 17th week in a row now.
I believe so. Yes.
Consistency is key.
Oh yeah, we're starting to get the hang of this one. So today we're going to talk a little bit about how we diagnose pain. So if someone walks in with pain, we're really going to break down our system for how we figure out what the muscles are that are causing the problem, what the problem is to begin with, if it's something we can fix, if it's something we can't. So just to start things off, what kind of pain does the system work for?
We're looking at chronic pain. There's two types of pain that we're looking at. Usually, there's chronic and acute pain. Chronic pain is pain that's been there for a long time. Pain that's kind of I would say it's been developing. Yes, that's a great way to say it. And acute, something happened quickly. Like a good example of that, you ran your knee into a door and you bruised your knee. That would be an acute pain. You broke your leg or something like that. That would be an acute pain. So we can't do anything for that. That skeletal system has been damaged, or there's inflammation. Inflammation from running your knee into something like that. There's bruising. You got to let that heal. Those need healing. Your answer to that is healing. But those problems could turn into chronic pains if you don't fix the problems.
Yeah, for sure. Yeah, absolutely. Yeah, and that's consistently what we see is examples would be like somebody that's doing the same job over and over and over again. Athletes who are repetitively doing the same type of movement over and over and over again, like things along those lines. Anything where you're going to utilize one side of the body more so than the other side of the body that develops an imbalance, more or less.
Yeah, and I guess even some of the things that people might think would be a problem, but some of the stuff we talked in the past podcasts, like herniated disc and the degenerative disc and a lot of those spinal things, those are chronic issues. There's things that are putting pressure on that for a long time. Unless you were in a car accident and it happened because it was directly like you ran into something, like that would be a different scenario. But like if it's been something that's been kind of creeping up on you, that's probably chronic. That makes sense. Yeah, for sure.
And that's and this is where it's like like even some of these areas get kind of touchy because like some people are like, oh well, it just happened one day whenever I bent over.
Yeah.
But the problem was there. That was just like the straw. Yeah. So it's the thing that extremified the problem. The problem was still there. You were starting to experience maybe things like tightnesses and stuff along those lines, starting to limit your motion. And then whenever you go do that motion that's out of your range of motion, you end up hurting that area. So that's something that I hear a lot of people say whenever they come in for their 3 days is they're like, oh, well, this is the motion that did it, so that was the problem. Like, I shouldn't be doing that, which that's not really the issue. It's more so the muscle groups.
So let's say someone calls in, for instance, like Misty talks to them on the phone because that's who you're usually going to talk to if you do the 3 free sessions for anybody that's watching that hasn't done that yet. So let's say someone calls her on the phone and they say, I've had pain that's been developing over the last couple of months, last couple of years. Is that usually a good sign for you?
Yes, absolutely. Actually, like that's. If they were saying something that, oh, this just happened here, and really the biggest is we need to talk to them and know the very specific scenario. So like we would ask specific questions to ask, all right, what happened here? What happened here? And then the other is having them just come in and we can have that first initial talk and we can determine it on that first day. Sometimes that's the better even action to see, okay, let's talk a little bit and let me just, touch, feel, see how things are feeling to determine, this is this is a more of an acute problem, or this is more of a chronic problem, or usually on a phone call if we're talking to them and we can really distinguish, that's more of an acute thing. So it's that very specific scenario that like talking to the person and hearing their information, I guess, is the number one thing I would say.
Yeah, and I think some big things that we look at is if there was, like we're saying, we keep on saying chronic, just means happens over time. So if we feel like this thing's been going on for months, that's one thing we're like, yes, that's something we can help with. The other component would be, it's like, well, I injured myself here, but it's been months since, you've had a long enough time for recovery. So it's like, or I went to therapy, I'm out of therapy, now I'm trying to figure out what to do next because I'm still having pain. Those are all things that we work with. So like the things that we don't is, I just ran my knee into this yesterday, it hurts really bad. We're like, you're going to have to rest that. There's nothing we can. Or I just broke my arm yesterday. Can you do it? No. Like it's like you're gonna have to allow those things time for rest.
So whenever that healing process is over, if there's still pain, that's when we can help. That's a good way to look at it too. Because depending on the injury, the healing time could be definitely different. So some injuries may be a 12-week healing process. Some injuries are only a 1 or 2 week healing process. So depending on what is that healing process, I would say.
So the best thing is to call Misty and see what actually is the proper thing for you. Because everybody's scenario is a little bit different.
Yeah, for sure.
So whether someone's with you in the first 3 free days, Tyler, or if it's a client that we have who just comes in feeling a little bit of a different pain than they normally would, that diagnosis process starts by, how would it start? Do you start with massage? Do you start with stretch?
We want to figure out the exact point of pain first. Before we really do anything, we want to feel like practically like point where exactly you're feeling the pain.
Yeah.
That helps us at least kind of hone us in on what area are we really looking at. From that standpoint, now you want to start to see, well, like in our thought process, now what motions or what muscles lead to that, and what motions do you do that are bothering you? Because that's going to start knocking down which muscle groups are not a problem, which muscle groups are a problem, more or less. And then, once we see that, we can do some range of motion assessments where we're going to technically say, here's these muscles that are attached to this area, let's move them to see if there's any restricted motion that you're not getting that muscle group to stretch out to its full range of motion, more or less. And if that's restricted, then we're going to go test, and we're going to go massage that muscle group to see if there's tenderness. If there's tenderness there's a good chance that muscle group's a problem.
There could be knots in those, like that could be an area that we're looking for. lack of range of motion, or you can look at even depending on is there weakness somewhere. That's another area we're looking at, because if that muscle can't support the skeletal structure, that can cause pain. So we're looking at all those different factors to determine where the pain's coming from. I guess is where we're always starting.
Exactly. Yeah, and I think there's two components. Like we usually look at now, is it like a front to back thing? Is it a side to side thing? We have to identify which one of those issues is causing the problem. Is it a muscle that's leading to it, or is it a muscle that's adjusting the skeletal structure out of position?
That's a good point. That's a good point too. That's another thing we look at is you're saying you're having a pain somewhere. We're looking at to see, is there any skeletal systems that are in the wrong position? So like even just in your shoulders, do your shoulder blades look like this, or your shoulder blades look like that? That's going to tell us a lot too.
And a lot of people have pain on the backside of the shoulders, like he's talking about there, because everything's pulled out of position. Yeah. So it's like it actually adjusts the bones out of position, which then that can be also a problem. So it's like doesn't always mean where the point of pain is that's actually the muscle groups that are leading to that are the problem. It could be the other side is causing the issue.
Yeah, and even playing on that same point is a lot of times people will point to a spot. So it's like if I'm having pain here, I want to look at the muscles leading to that. So I might be working over here. People are like, well, my pain's over here. Why are you over here? I'm like, yes, that's where the pain is, but that's not what's causing the pain. This muscle leading up to that is not elongating. So it's yanking and pulling tug-of-war game right here on that spot, and that's what's causing the pain. So then I need to work on letting this go and let this start elongating correctly and start moving right so that it releases the pressure, so that's not putting pressure there. So that same concept of that, we might be looking here to the backside of the shoulder blades for an issue, or we might be looking, just straight from that pain, but it's almost never where the pain is. Like that's what I think most people don't realize whenever they're coming in is we want to know where the pain is, but we use our understanding of anatomy to figure out what's leading to that, because that's what's really causing the pain, something that's leading to that. It's almost never the problem when it's right there.
Yeah, it's kind of fun. It's like a puzzle.
Yeah.
Like we have to go figure out which one. And it's kind of like process of elimination. Then we go through, like, here's all the muscle groups. It could be, some places 6, 7, 10 different muscle groups that attach to a specific bone. We want to go look at what are all the muscles that lead to there, and then we go assess them all.
Yeah.
So it's like, and for everybody, it's always different. It's like, it's not always the same one for everybody. So it's like, you can't really standardize, okay, this is the muscle group that causes everybody pain. There's 600 different muscle groups. Like, it could be any of them.
Yeah,
so
100%.
This is why assessing is super important, so we can figure out the one for you. So, yeah.
Okay, so out of all those things that you mentioned could be causing the pain, or things that you look at, for instance, with stretching, what kind of range of motion are you looking for?
Well, it depends on what you're talking about.
Let's take me. So, like, in the past, at this point, anybody that's been watching our podcast know that my left shoulder is jacked up. So
not jacked the way that people would say.
Not in that way.
Jacked up.
Yeah.
She has shoulder issues, and we work always.
I had a previous injury that I did not work out well because I didn't know what to do at the time that my injury happened. And now that we work here, well, you think that I would spend a little more time on my own shoulder, but when you're constantly busy, it kind of makes it hard to. So prioritize your pain, folks. Don't end up like me. But for me, I have a hard time keeping my arm up and then also rotating back. Like, you can even see I try to arch my back to make my arm try to go back whenever it just can't. So for a range of motion, let me kind of turn to the camera so they can see, what would be a good range of motion? Because this is basically, if I'm holding my shoulders back, this is as far as I'm going to get.
You should easily be able to get to about this angle back here, and you're not even to 90 here. So you should be able to get way back there. Further. And then you see you're trying to get to there because you feel like you should be able to get there. So you're trying to compensate, but you're trying to move your spine now, and you're trying to move to get your arm to go farther back. So because I should be able to go back there. So like for a person that you're driving and you need to go reach in the back of your seat to grab something, you don't have that range of motion to reach back there, you could hurt yourself. And that's one thing that can happen. Or you're like, why can't I move? That's usually most people, or they're almost like, well, I feel like I'm stuck. And that's what it is, because their muscles aren't elongated to allow that movement to happen.
Or something will over elongate, and then you get like a spasm, which is what happens to me a lot. Whenever I go to reach for something behind me, and then something else stretches, I probably shouldn't.
Yeah, or you're trying to use something else to compensate, and now you're a muscle that shouldn't be doing a movement pattern is trying to do that, and it can't do that. And then that's where a muscle spasm can come out of that, 100%. Yeah.
So you're looking for certain ranges of motion. If they don't reach that, that's whenever you go into what would be the next step.
Yeah. So even on that, that's So what I would look at all range of motions, you know,
Okay.
and that's probably, you know, I'll be like, make sure, so how does it look going up? How does it look going forward, backwards? But then as an example, we'd have found, ooh, that's not moving. So like, we would have looked at all the ranges, and we know that one. So you can tell, I'm not even trying to stretch. You can just tell your body does not want to move into that
it
position.
doesn't.
So that's internal rotation is not moving because we're trying to go back into external rotation. So like that's kind of what we're looking at. So now we have to look at what are all the internal rotation muscles, and we go, you know, start digging into all those, and we start palpating and determining, you know, is there tenderness? Is there knots in those muscles to see if there's a problem there? Because if we can get those knots out, does that increase the range of motion?
Yeah. So and there's like 5 different muscle groups in there.
Yeah.
So it's like it's a process of elimination of seeing which one's actually tender, tight, not moving well, and then is there any shoulder motions that are overlapping? That this like, okay, so she's not able to move into external rotation, but like maybe she's also having problems like moving this way or something along
Yeah,
those
like
lines.
coming back.
Going
Yes,
back.
exactly.
It
So
isn't
like those
great
are
either.
so those are
Yeah.
different things that we would
Yeah.
look at to see if there's any crossover between like there's one muscle group that keeps on sticking out. So then that kind of helps us with identifying on which one is actually causing the problem. So the one that's
And
overlapping.
Just an example of that, like he's talking about if this movement or this movement wasn't moving, the two most common that would be in both of those would be your pec major and anterior deltoid. So that would be the first two I would look at to make sure those are the problem area ones.
So those will be holding back the moving, correct?
Yes.
That's what's going to restrict the motion.
Yes.
Okay.
Yeah. So we're trying to elongate it, and it's not elongating. So that's why it's not. You're trying to go, and it's like boom, hits a brick wall because that muscle's not moving anymore, and it should be able to move to back here, but it's not. And that's what we're trying to do is try now to get that muscle to do that.
Okay. So once you've pinpointed, for me, you just mentioned pec major and anterior delt.
Yep.
So these two right here would be restricting. Oops, sorry, I might have messed up my audio. Oops. Those would be restricting the ability to move the way I need to. So what do you start doing with that?
I even actually even looking at this, another area that I would look at back to we talked about the skeletal structure. I can already see that her shoulder blades are more forward than they should be. They should be way back here. So that's already another thing. Now I'm already thinking about it. What is attached here that could be pulling forward? And the number two are also the two in the pec minor could be, but the pec major and anterior deltoid are attaching there. So I'm seeing commonalities. That's what I'm really looking for. Is what some commonalities sort of like is the story that I'm trying to put together here about what's causing the pain correlating. You know, so like, okay, we're restricting range of motion in this. Okay, the skeletal structure is out of position here. Where we're looking at all those things. So now, this is what she was getting at next, is now I want to go, now if I go dig into those muscles, are they really tender? And that would almost confirm the story that I'm putting together, what's causing this pain. So then I would go.
Bracing myself to try it out on them.
So then I would even just like in the anterior deltoid, this is the deltoid, I would be, going in here and I'm going to palpate and dig into these muscles and see if there's tenderness in this as we're doing it. I probably need a little lotion. I need to kind of move, so I don't have any lotion here. But even just digging into that, so yeah, we can see there's tenderness already there. And then I want to dig into the pec here, the pec major. I'm not going to dig in too much into that, but that's what I would look into. And I'm going to dig into that pec and see if there's tenderness in there. So I'd be really dig in to see, okay, because really a muscle shouldn't be tender at all. Like you should be able to apply a lot of stress, a lot of pressure, and it should be like, yeah, I don't feel that hardly at all. Like that's what it should be. But we're using every time you're using those muscles, they're sitting in bad posture. They get like overly tight. They get too knotted up potentially sometimes, and they don't move.
Yeah, exactly. And that's a lot of it. Is like the myofascial tissue is what's the connective tissue that forms over it and has tons of nerve endings into it.
Yeah.
So that's what makes it so sensitive because the more layers that you have, the closer it is to the surface. So depending on how much pressure you put onto it, it can be super tender, or you got to dig in deep to get the deeper muscles. So that's kind of like what we assess. What we're assessing there is how much buildup of tissue do you have in those areas, and that's kind of what's restricting that motion from being allowed to go back in full range.
So to the touch, how can you tell if there's a buildup of tissue?
So it'd be like density.
Yep.
So is it hard? Is it soft? So like if it's hard, it's obviously going to be a problem.
Muscle is soft tissue. It's what it's called. It should be soft. I know most people are thinking, oh, rock hard biceps and all that. Like that's actually not a good thing. That's not a good thing. Muscles should be, especially when they're relaxed, should be very soft. When they're contracted, they should be hard. So if you're flexing your bicep, yes, it should be hard. But when it's relaxed, it should be soft. And a lot of the times when we're having someone, it's not. It's very dense. You're digging into it, and it feels like a rock almost.
Or there's knots.
Yes,
knots is the other. Like
Yep.
you'll feel bumps through the muscle tissue where maybe you've had like tears in that muscle tissue and build up in one spot. And you'll feel a big old knot.
Scar tissue is a version of that, like you can see. And then it's just sensitivity. Tenderness is the other one you're looking for, because if it's super tender, that's meaning those myofascial tissue is not wanting to elongate. So that's its way of telling you, nope, I'm not going to do this right now. I'm not going to elongate, and it's holding it tight. So we got to try to get that to settle down. We got to break down that tissue. We got to get that muscles to start elongating again. So when you go, you have the full range of motion, and that skeletal system, so the scapula and shoulder could drop back where it's supposed to, not be stuck forward like this.
Yeah. So and I always think especially with exercise, everybody kind of gets it. Like in order to be able to get stronger, you have to put more force on your muscle tissue for it to grow and to break down. Same way whenever we're doing this type of movement, you have to put more force onto that muscle tissue than it's used to in order for that myofascial tissue to break down as well. So it's it's not going to feel good. Just like exercise does not always feel good all the time whenever you're doing it.
Yeah.
You're feeling that burning sensation, stuff along those lines. It's exactly the same thing, same process we're going through. Instead of contracting the muscle, we're trying to get it to elongate.
Yeah.
So we're trying to get the muscle structure to change in a different way, more or less.
Yeah, so it can be super sensitive at first, too, and this is where, and it's a progress. So, maybe at first we're digging, and it's like, I'm just putting, this much pressure, and it's super sensitive. Sometimes it is. When we're in that's the amount of stress we can put. We always use our scale of 1 to 10. 10 being, that's way too much, almost jumping off the table. Yeah. 9 being, that's very tender, still too much, but I'm not going to punch you in the face. And then 8 being, it's tender, I can take it, but only for a little bit. But we're really looking for that 7. It's tender, but I can take it. And that's what we're looking for. That's what we want to be digging in. You're digging in, you're like, ooh, that's tender, but, it's super sensitive. It's super tender. But, if I'm only putting this much pressure, I'm getting that, it's going to be hard to get a lot of stuff done. So, we got to
take time.
Yes. So sometimes it's a time game. We can't just go in and just break that whole tissue up too quickly, because one, it's going to be super sore, and it's going to hurt really bad. So we got to kind of start building that muscle up, getting used to tensions. You don't go in the gym and just start lifting the heaviest weights. You got to start at where you're at, and you start building up from that. And that's kind of what we do with this at the same time. We start how much sensitivity your muscle can handle, and we start building up from that. There's a lot of things we do to get it to settle down, and it just keep progressing from that.
Since we're talking about the massage aspect of this, that sometimes after your first session, there might be a little bit of bruising. You might be a little bit a little sore. And I think that's a completely normal thing. It happens for the first time or two. That might be the case, but that shouldn't be something that progressively happens.
Yeah. Usually, on the first few times we see somebody that's having a pretty severe, issue, a lot of times it's literally feels just like you worked out muscle soreness. That's the same muscle soreness that you're doing, because you are. When you're exercising, you're breaking muscle tissue down. This is what we're doing. We're breaking muscle tissue down. And sometimes there's scar tissue in there, and there's myofascial tissue that's built up, and we're literally breaking that down. And when I say breaking it down, you're damaging the tissue so it can rebuild. So there could be bruising, and that's totally normal. And that's after that, it needs to heal. So we usually give you 24 or 48 hours, depending on the severity of it for the person, but it heals very quickly, and then you can kind of start working on it again. Yeah.
And I know for a lot of people that's kind of concerning, knowing that it's going to hurt. Yeah. The key is that we're going to, once we get that, it's only through a little bit of time that really happens. And the key is we're trying to get that muscle to get it to stretch back out. Yep. It's because that tension is going to be released off of the bone that it's attached to. So that's what we're trying to do, is we're trying to get tension released off of the bone. That's where your pain and relief goes away. So that's where a lot of our people are like, I'm willing to go through the little short-term amount of pain because it gives me so much relief later. Yep. And that's kind of our overall goal too, is through the massage, through the stretching, our goal is to release that tension so you don't have that pressure all the time.
And, as far as tenderness goes, how tender it feels at the beginning of the session is never as tender as it feels by the end of the session.
Yeah. And then from session to session, it should be getting better, or we're putting more pressure to get to the same tenderness, because really we're still going to get to that 7 every time, but
Which is progress.
Yes, 100%. I might be only pushing this hard the first time, but the next time I'm really digging in deep. I can tell you were prepared for me to push harder.
I was let's go.
But yeah, so that's kind of what we're trying to progress that way. But the tenderness does get better, but the number one is after you do it, you go through that pain, you stand up, you move your arm, you're like, that feels way better. You know, like that's a win all day. I'll take it all day. If you're having, you know, something that's with you all day, pain-wise, or go through pain for 15, 20, 30 minutes, and then be out of pain for the whole rest of the day, if not weeks, you know.
For sure.
Yeah, I got the joy of actually working on my aunt, so I don't know if she'll see this or not, but shout out to Aunt Joyce. I got to work on her yesterday, because she was talking about how she had, like, some nerve pain going down through her hip and down through her leg, and so I was like, well, here, let me show you what I do, because, you know, a lot of people don't understand what we do, and it's like, I can explain it to you, or I can just do it to you right now. And so, you know, we went through the whole, like, she had a lot of tender spots. I stretched her out. Her range of motion improved after we massaged, which would be our next step that we're going to talk about, right? Just to get ahead of us a little bit. But one of the things I said, I texted her, and I was like, hey, listen, I forgot to tell you this. There might be a little bit of bruising. You might be a little sore.
Yeah.
So just a heads up, because it's the first time this has ever been done to you. And first time she'd ever been stretched by anybody else, too. So it was a whole bunch of firsts. A whole new experience for her. I gotta kind of do the thing that you guys get to do with people every day too. And then she texted me today and was like, hey, you know, I expected to be sore, I expected to be bruised. I'm not. I actually feel pretty good.
Yeah.
So
Nice.
not always. You might not always be bruised, and if that's the case, that's actually a pretty good sign.
Yeah,
absolutely.
Yeah, it is 100%. Sometimes it doesn't. So we always just like to prepare people because that's the number one. People freak out if they're like super sore. They're like, I feel worse. It's like, well, you feel different. It's not worse. You know, like it's a different soreness. Like, and it could be a little, you know, or there's bruising and they just don't understand why there would be bruising. So they think that that's a problem. So it's like just preparing you to understand that is the key. And a lot of times it's not. You know, like it's probably one of those, you know, 1 in 10, 2 in 10 people have it, but it happens, you know. But so it's always good to make sure you understand that. Yeah.
Sure. So after you've worked out the muscle, you've improved the density. It doesn't feel as tough. What is your next step after you've massaged it out?
So if we feel like the muscle, you know, knots are out and the density's out, and it has the ability to elongate, because that's really what the problem is. Why we're massaging, because we're trying to move it and the muscle's not moving. So if we feel like we got it to move, we got to now start elongating it. We got to start stretching it, because that's what's going to really take the tension off. If the massage will help, but it ain't going to really take the tension off, because that's where you got to elongate that muscle so there's no tension there.
Yeah.
So that
the massage helps it stretch.
Yes.
So it's like if it's not stretching, then that's where we utilize the massage to make sure it allows those muscles to relax so you can stretch them.
So then we would do specific stretches for, in this scenario, the pec major and the anterior deltoid, and each one's a little different because they're in different movement patterns, and we try to make sure we're stretching all of those to elongate it, and you're going to feel that, those muscles stretching now, and that's what we want to make sure as we're going into it, like, yeah, I feel this stretching right here, because that'd be the pec major, or if the deltoid, oh yeah, I can feel it stretching right there, because we want to make sure those muscles are elongating, because if we can get those to start elongating, then you'll be able to now bring your arm further back like that. So that's what exactly how we do that. Yeah. Anything
Sure.
right?
No,
Yeah.
I think that's pretty much it.
So is that pretty much the process in a session? Or
So that would be the short term, and then the actual long term answer to that is you have an imbalance from internal to external rotation. We got to get you the muscles on the backside that pull backwards stronger, because if these are stronger than these back here, so you're losing this battle, and that's why you're always coming this way, and this keeps getting tighter. We need these to be stronger so that they can pull out. So that's the long-term answer, because even this stretch and this massage, if you still have that imbalance and you go back to doing your daily activities, it's going to come back eventually. Yeah. So like that's where, and it may last a good amount of time, but it will come back if you don't fix this imbalance. So then the last level is now you got to start strengthening the opposing side. So we do exercises where you're pulling back, activating these, and elongating this exact muscle, the movement that we were just talking about. Then that's what's really going to fix your problem, if you can get that strength balance back.
So I think a big question I always get asked is, now how long do I have to do this?
For it really to a level, you're going to have to do some sort of version of this for the rest of your life. I mean, it should be part of your daily habits, is what it is. Yep. There's a level of how fast do you get the result, you know, like, and that's what you're trying to do, because we're trying to get you out of pain. That can happen quick. But if you quit doing the actions, you're going to go right back down. You know, it's going to go right back to the same spot.
Unless you drastically change your routine that's causing that issue.
Yeah, that's true.
That's one component. So it's like things that we'll even look at. It's like people's sleeping patterns, the way that they work, the activities they do, stuff like that. Anything that's possibly causing their issues. Otherwise, you got to make sure this is where exercise is supposed to be a way to get your body to get back to equilibrium. We're trying to get your body back in balance. So it's like a lot of people are like, oh, well, I got to go work out at the gym and I'm going to do all these things. But what if you already used all those muscle groups? That's going to cause the problem to get worse, not better. So this is where, like, being able to get an evaluation is really helpful to be able to understand what do I really need to be doing for my specific problems, and how long do I need to be doing that for. So I think that's always a consistent question I get. It's like, well, now what do I do? It's like, well, you got to start doing that, and then it's progressing and making things harder so your body can handle more stress.
I think I always like to use the dentist and brushing your teeth as the example. So if you're you've been brushing your teeth for 6 months, you're like, how long do I have to do this? If you quit doing it, your teeth are going to start rotting out. So it's the same concept. Like, I've been doing it for 6 months, shouldn't I be good now? Like, no, you got to continue to do it every day, in and out, over and over, forever. It's the same concept. So if you quit doing that, quit taking care of your teeth, they're going to go start rotting out. They're going to start going the opposite direction. So it's the same concept of that. Like, you're trying to maintain healthy muscles. So you have to do things all the time to make your muscles healthy.
Yeah,
it makes
sense.
Like
digestion. Like, you can't not just stop eating. Like, oh, I ate today. Like, I should be good for like 6 months now. Like, that's not how it works. It's the equilibrium system. You have to keep it going always.
Mm-hmm. Yeah.
So after you've gone through the whole diagnosis process, you've got your game plan for strength once that joint starts to feel a little bit better, less pain, because you don't want them to jump into exercise until the pain is gone, correct?
Yep. Yeah, that's a good point too. Yeah. Okay. I was just gonna say that. Yeah. I mean, so a lot of times if you're trying to activate a muscle that isn't moving, it's gonna cause the problem to be worse. Actually, so that's where we almost take it into steps. And it depends on the person. Is sometimes we start and it's only massage at first, and then we finally can get it to moving, and then we can start moving to now they can move and stretch, but they're not. It's not to the exercise level yet, and then maybe we're moving into that exercise later, or sometimes it can happen immediately, and we can go, oh, I can massage that out. Yeah, it's moving good enough, and I can do all 3 stages on the same day. Why? But it's different for each person. I guess is kind of the point I was trying to make. Yeah.
But now that everybody kind of knows that diagnosis process for you guys, what would you say is kind of your end goal to the system?
Create an action plan that kind of what is actually causing your pain. Because a lot of times when people go to the doctors, they're like, yeah, it's a herniated disc. Yeah, but why is there a herniated disc? So that you know what to do, you know what's causing your pain and what muscles are causing it, and you know what to do on a daily basis, weekly basis, whatever that is, every week to prevent this becoming a problem. And that's what we're trying to do always is create an action plan so you know what to do to get yourself out of the pain. Even what we're doing, we'll come in here, we'll figure out what's your problem. And a lot of times just if we're doing 2 to 3 times a week isn't enough. So it's like, I need you to go do this at home. So we need to create a habit, routine, actions around this to prevent this becoming a problem long term. So that's kind of why I always get action plans to get this to be gone forever.
Yeah, and your action plans are always evolving daily, weekly, monthly. We're consistently evolving your action plans because, based off how you're feeling, progressing, modifying things in order to be able to make things we have to get, and the key is why you have to do this so consistent. If you don't get the right stress on the body, if it's either too little or too much, you're not going to get progress. Yep. So the key is maybe making sure you're getting the right amount of stress so your body can start to actually move forward. So I think that's a big thing that we consistently do. If you do an exercise that's out of your ability level, you're not going to be able to, you don't have the ability to do it. If it's too easy, it's not going to push the muscle hard enough. Yeah. So
a point I like to think about is your body adapts pretty quickly, actually. So if you're doing a stretch or you're doing a massage, you're doing an exercise, actually in about 3 to 4 weeks, 2 to 3, 4 weeks for that time frame, your body's going to adapt, and that action is not going to be for you. It's going to be too easy now. So that's what you need to be doing is you need to reevaluate. Okay, what if I'm stretching this and it's not stretching too much anymore? How do I make it stretch more? What's the next stretch? Or I'm massaging this. Do I need to go deeper? Is it good? Is an exercise? What's the next exercise? You always need to be looking at how do I progress things every 2, 3, 4 weeks. That's the range you're going. If you're going past that time and you're doing the same exercises for 3 to 4 weeks in a row, you're probably not progressing. Or you're doing the same stretches for 3 to 4 weeks in a row, you're probably not progressing. Unless you're in the stretches, you're getting a little deeper each time. That would be the only variation until it's to where, all right, I'm maxed out at this stretch, and I need to move to a different stretch.
Yeah, and this is where I think that people run into a problem, especially post-therapy, is that they give them these exercises that they're supposed to be doing daily. They do them for, like you said, 2 to 3 weeks. They get easy, and they're like, well, now, do I just keep doing them, or I think everything feels okay? But the thing is you got to keep on progressing. You can't just go back to your normal. And a lot of times, whenever people are in therapy, they're in less active activity than they usually are because they're hurt. So then what they do is their activity's low. Those exercises get them initially out of pain. They go back to their old lifestyle, which was more activity, stuff along those lines, and then now the problems start to come back again. So this is where constant regression is super important, so we can get you to, here's the level of exercises that you need to do to fit your lifestyle. And if your lifestyle increases, those exercises have to increase too. So it's like you have to consistently be building more endurance and strength in those muscles and to be able to withstand that level of stress that you're putting on your body.
Absolutely.
Well, guys, if you have a chronic problem that you're dealing with and you want to go through this process with Tyler one-on-one for the first 3 days.
Really fun.
And then moving past that with our trainers that we have here, make sure that you sign up for the 3 free sessions. You'll be talking with Misty, who we mentioned earlier. She's the one that does the initial call, talks to you, kind of gets all the information, and make sure that we can help you, that it is that chronic problem, not that acute one where it would be more structural, like we talked about at the very beginning of the podcast. So, sign up for your 3 free sessions. We'd love to come see you. Love to be able to show you how your muscles and how your body works and how we can help you always, progress towards the lifestyle that you want. Do you guys have any parting words for us?
Even if you're just interested, maybe not signing up for the 3 days, you just have questions, you can call and we'll talk. We can talk just to discover if this is going to be a solution for you. So that's just something I was thinking about there.
Yeah, comment below if you have any questions or anything like that. If you don't think that we can help you, well, it can always be a conversation to see if we can.
Okay, guys, like, comment, subscribe, and don't forget to tune in next week. We'll see you then.